The misophonic brain of hatred of sounds. Does hearing certain sounds evoke feelings of uncontrollable anger or disgust? You may have misophonia. Misophonia, literally hatred of sound, was proposed by audiologists Pawel and Margaret Jastreboff in 2000 as a condition in which negative emotions, thoughts, and physical reactions are triggered by specific sounds. It is also called select sound sensitivity syndrome and sound rage. Proponents suggest misophonia can adversely affect ability to achieve life goals and to enjoy social situations. For majority, the sounds of lunchtime chewing or a coworker clicking their pen are everyday components of an auditory landscape that go largely unnoticed. But for some, these seemingly ordinary sounds are painfully unpleasant to the point of eliciting uncontrollable irritation or rage. Misophonia is recognized as a legitimate psychiatric disorder, and the sufferers shamefully hide their extreme emotional responses to these common sounds. Actual prevalence remains uncertain due to its relative obscurity. Studies suggest that it typically strikes in adolescence, affects men and women equally, and may occur in much as 20% of the population. The most commonly reported trigger sounds include eating, breathing or repetitive behaviors like typing or pen clicking. Hearing such sounds often evokes uncontrollable irritation, disgust or anger, which the individual recognizes as socially inappropriate. Usually the misophonic try to suppress any outward reaction, but few express with verbal or physical aggression. These aversive responses in fact manifest as measurable physiological arousal. Compared to healthy controls, misophonic individuals have excessive skin conductance responses to auditory stimuli, and the magnitude of these skin responses correlates with how distressing the participants perceive the sounds. The symptoms of misophonia largely overlap with other clinically accepted psychiatric disorders, including obsessive-compulsive disorder, post-traumatic stress disorder, and various phobias. Some individuals reporting misophonic symptoms also have comorbid psychiatric conditions such as attention deficit hyperactivity disorder, hypochondria, obsessive-compulsive disorder, or eating disorders. Myron Edelstein, at the University of California San Diego, researched on misophonia, and published in the journal PLOS on 24 September 2017. Researchers suspect that misophonia is not a primary auditory disorder, but rather stems from aberrant attentional or emotional processing later in the brain's auditory system. An EEG study on misophonic individuals showed a smaller N1 evoked potential than controls elicited by unexpected auditory tones. The N1 is involved in early attention and detecting sensory changes, suggesting that abnormal attentional signaling early in the auditory processing stream may contribute to misophonia. Interestingly, an altered N1 peak has also been associated with impulsivity, drug abuse and bipolar disorder. Recently, researchers used functional MRI to examine brain activity in misophonic individuals while they listened to sounds that were neutral, unpleasant or characteristic misophonia triggers. The misophonics rated the trigger sounds as more distressing than the unpleasant or neutral sounds. Critically, the misophonics showed greater activation in the insula than controls during trigger sounds, and this activity increased with greater reported distress. Furthermore, functional connectivity between the insula and other brain regions involved in attention and emotion was altered in misophonics when listening to trigger sounds. Although the insula has been involved in a plethora of cognitive processes, its proposed functions include internal awareness of one's body and emotional states. These findings suggest that misophonia is associated with pathological activation of a brain network supporting interoception. This altered brain connectivity seen in misophonia is similar to that occurring in synesthesia, a condition in which one sensory stimulus evokes sensation in a different modality. Faulty enhanced neural connections lead to abnormal associations amongst sensory and emotional brain regions in misophonia. Effective therapies have been inadequately assessed. There is some support for the use of cognitive behavioral therapy and conditioning retraining. Hopefully, With further research into both its psychological profile and neurobiological underpinnings, misophonia will gain both greater social acceptance and effective treatment options. Thank you.